that mesonephric duct. If it's a male, it's called a Mullerian duct. I mean a Wolvian duct. If it's a female, it's called a Mullerian duct. So if I have a deformity of my uterus, I'm going to go and check my patient's kidney. If I have a deformity of my kidney, I'm going to take a quick look at my uterus. Only on females. I'm not going to disrobe a male to look at his testicles or his penis. It doesn't work both ways. Okay? But because you found an abnormality of the kidney, we're going to bring that male back in for a scrotal ultrasound. Everybody understand? No? Yes? If I have 2 uteri, okay, that's an abnormal uterus. Okay? So I only know that because I had an agenesis, meaning no left kidney. So me being a good sonographer, I'm going to look at the patient's uterus and find out that she has 2 uterus. Okay? The mesonephric duct is one and the same. That's why they call it the renogenital urinary tract. They form from the same thing, the mesonephric duct. Can I draw it?
Yeah.
No, I can't draw that.
So if the patient only have 1 kidney, that's when we look for.
Anytime, if I have a short horseshoe kidney, I'm going to go down there and look. Anytime I see an abnormality in the formation of the uterus, I mean of the kidney, I'm going to very quickly just go look at my uterus. If I'm doing a uterus and I find out that there's an abnormal uterus, I'm just going to go real quick and take a sagittal and transverse of each kidney.
Why? What's the relationship?
That's what we've been talking about for the last 30 minutes. They form from the very same thing. The mesonephric duct, okay? So here, pronephros go away. This leaves a duct for the primary, and that leads up to the mesonephric duct. The mesonephric duct, in males, it's a Wolvian duct. In females, it's a Mullerian duct. So everything forms here. The kidneys move up into the renal fossas.
Okay.
Got it?
Yeah. This is just in the baby, in the fetus, not
every human.
It stays with the person since he's a fetus, and stay with him when he gets older. And
yeah, once you get to this stage, that's your regular kidneys. This is what you're going to grow and die with. You're going to be born with them. You're going to die with them, hopefully.
Because that's the last stage, right?
That's the last stage. Okay? See, definitely a kidney at week 10. And so we should start seeing urine in the baby's bladder at 10 weeks.
So, is there a name for that two mesonephric duct merge and also missing the left kidney? Is there a name for that?
Renal agenesis. That's just it. They're not, I don't know how to explain it. It's just something that we have to practice.
Okay.
I can't tell you why.
Yeah.
Because of the mesonephric duct. okay? Because if I have an abnormally shaped kidney, I could have an abnormally shaped genitalia. Because they both come from the exact same thing. Okay? Everybody understand? That was not a stupid question.
Oh.
So I understand that if you can't find a kidney, that you would check the pelvis.
You automatically check the
And
pelvis.
when, just now that you just said that if you have an abnormal kidney, would you also
You automatically check the uterus. Okay? That's why whenever we teach you kidneys, that we go and look at Morrison's pouch. Okay? Morrison's pouch is between the liver and the right kidney. We automatically check that. Okay? Is at some facilities it's routine, it's part of protocol that we check that. Why? It automatically shows us that you have a kidney on the right side. Okay?
Why? It automatically what?
It automatically tells us that you have a kidney.
Oh.
Because when we take Morrison's pouch, we're showing the inferior part of the liver and we're showing the superior part of the kidney. Okay? Uba, you got a question? Any questions? Embryology, it's very difficult. It's very difficult. Especially since we haven't even studied it yet. Okay?
Yeah.
Okay?
It's too much.
It is a lot.
Yeah.
Okay. So, let's go back to pronephros. The pronephros are only there for 4 weeks, but they leave a duct that is picked up during the next stage of development, and they are still non-functioning, okay? But these go away, but you need the mesonephros because look here, it gives rise to the reproductive structures. What are the reproductive structures? Ovaries, uterus, testicles, penis. Okay? It's just that the females are on the inside of the body, the males are on the outside of the body. Okay? So if you're missing this phase, then you have no genitalia.
Which means there is no sign of
Male or female.
which is not happening.
Okay? But if you don't have this stage, you would never get kidneys. Yes, we do have that. Okay? Can you live without kidneys? No. Unless you're on dialysis. And there are babies that immediately are born and they go on dialysis.
So they never have a person with one kidney,
Oh yeah. Lots of people are born with just one kidney.
and they can survive.
Why? Because the kidney is not just 9 to 12 centimeters. It's going to get up to like 17 centimeters. You know, because it's going to compensate for just having one kidney.
Oh, okay. That makes sense.
So, and here we have one of the variation. The 2 kidneys are not available. The normal, no, new something like number. The deformation.
The normal variants?
Yeah.
Yeah, the normal variants qualify for a uterine abnormality.
No, somewhere it says just the baby have no kidneys.
That's
The
not
2 of them.
compatible for life.
Yeah.
Agenesis.
Yeah. So
If you have agenesis, you can have unilateral agenesis and you can have bilateral agenesis.
Okay. Yeah. Bilateral.
Okay? If it's
Okay.
bilateral, that's not compatible for life.
Hmm.
The baby will not live
Till when?
until it dies.
No, I mean, no.
I don't know. Some of them will, what we know is probably gonna be less than a week.
Yeah,
Because it has all those toxins left in it from when it's in utero.
yeah,
Because if the kidneys start making urine at 10 weeks,
yeah.
and it hasn't gotten rid of those toxins for 30 weeks,
Mm.
it's probably gonna be stillborn.
I mean,
Or it's gonna die shortly after birth.
he complete his time in his mom's uterus, and he will born like
Mhm.
regular, but after that he will die.
He will die. Unless he can get a kidney transplant
Mm.
or dialysis. And dialysis is really hard on the little ones.
Yeah.
Okay?
Mhm.
So you need to know that the mesonephros is what gives rise to the reproductive system. And that's already at 9 weeks. Because it's already determined when the sperm meets the egg, whether it's a boy or a girl. Okay? If it's a boy, what's it going to be called? Wolvian.
Yeah.
If it's a female, it's going to be called Mullerian. Okay? Fourth week, mesonephric duct. Already talked about that. Okay, so the mesonephric duct turns into the Wolvian duct, and the Wolvian duct gives us our epididymis, our ductus deferens, and our ejaculatory ducts. On the female, the mesonephric duct develops in the paramesonephric duct, also called the Mullerian duct, and it gives us rise to the uterus and the vagina. The fifth week, that's when the metanephros take place. Those are our permanent kidneys that will carry us through the rest of our life. Up near the pelvis, it is expanded. It gives rise to the pelvis, the calyces, and the collecting tubules. The lower end, the unexpanded proximal portion closest to the kidney gives us our ureter. And the nephrons, they are going to be the functional part of our kidneys, and they give rise to the mesoderm around the bud of our kidneys. That 8th week is when the nephrons start working. The kidneys will start moving from the pelvis to the renal fossa. That migration doesn't finish until 5 or 6 years of age. These are the measurements I need for y'all to remember. I don't agree with the ones that are in the book. Okay? If the kidneys are not within 2 centimeters of each other, I think here at Harris Health we use a centimeter and a half, then go back and re-measure your kidneys. Okay? Go back and re-measure your kidneys. In the medial portion of the kidneys, we have our renal hilum. That's where you have all your blood vessels, your lymphatics, your nerves, your ureters. All of those will enter into the kidney. So, they're bean shaped, so the hilum area is concave. The lateral outside border is convex. This you do not have at all, but you have to know it. Pediatric, if the baby is greater than 1 year old, it has to measure at least 6.8. Less than 12 months, the kidney will measure 5 centimeters. If you have one kidney, it's going to increase 20% bigger than if it were to have 2 kidneys.
1 to 20. 1 to 20 or 20%.
120% greater than 9 to 12.
Is that millimeter or
Centimeters.
Centimeter.
Mhm. Okay, so this you've already known, retroperitoneal, 3 layers, a renal capsule, perirenal fat or adipose tissue, and you have a fascia that surrounds these 2 areas, and that's called Gerotia's fascia. So the capsule is innermost. It's continuous with the ureter and the hilum. It's what gives the kidney a glistening appearance, and it helps serve as a barrier for trauma or infection. The perirenal fat or the adipose tissue is what helps our kidneys stay in their place, and they also help cushion the kidneys during any type of trauma. Gerotia's fascia, it surrounds everything, including the adrenal glands, and it helps again for anchoring the organs and offering that support. Here is a cross section. So here I have my pancreas, I have my kidneys. The right kidney is lower than the left kidney because of the large liver. Here's my L2 spine. How many L spines do I have? 5. Okay. Here's my aorta. Here's my IVC. So I have the capsule. What comes next?
The what? Adipose?
The perirenal fat, and behind all of that, Gerotia's fascia. Okay, that when we inspirate, our kidneys move, and so that's why it's important when you do your exams, you pay attention before you ever hold your patient's breath or tell them to take in a deep breath. You watch the kidneys move. Okay, that will tell you, do you need to take in a deep breath? Do you need to blow that breath out? Do you need to catch it on the way out and say, stop breathing? Or do you take in the deepest breath that you can to try to get it to into your line of fire? Because they do move. Ptosis, I don't have the slightest idea what that is. I never even heard of it until I opened up this book. It happens when the fatty tissue around your kidney dwindles, and that can cause a kinking of the ureter. Or if your ureter kinks, it's going to back up the urine, and then you're going to have hydronephrosis. Relational, you have to think of the kidneys and what's around them. You have anterior, posterior, medial, lateral, superior, and inferior. Now, remember how the liver has little faucets to sit stuff in? So do the kidneys. Okay? The kidneys will tell us what is going to be in that area. So it's important while we breathe the patients to try to, these little things don't move, but the kidneys do, because they are retroperitoneal. The diaphragm moves them. If it's peritoneal, yeah, those move too, 1 or 2 centimeters, because they breathe with, you can see those organs move with respiration. But the kidneys move more so with respiration than your internal peritoneal organs. Okay, renal artery, lobar arteries, interlobar arteries, arcuate arteries. Then it goes into what? Before we go to the next one. Huh? Goes into afferent. Afferent to capillaries to efferent to venules to veins. Okay? Okay? And that one we already know. And everywhere you've got an artery, you've got a vein. So be sure you know that the vascularity. Yes.
We don't have that. Open up the two that
You haven't? Okay. Well, let me send it to y'all real quick. This is the one that came with the book. I didn't send it to y'all?
No. I opened the two that you sent.
Okay. Let me, so I don't forget.
Not here.
And I will
Definite
forget.
after interlobulus. In the books.
This is the one that came
Oh,
with
so
the
S.
book.
Yeah.
Yeah, because I've been lecturing every day on what I've got made.
Yeah, interlobar is the big one. Bring it to accurate.
Yes, it is.
Interlobular is small.
Interlobular.
Yeah, interlobar, the big first one.
She said after arcuate artery start.
Interlobular, different.